in the test lab.
Medical physics is using physical approaches to help in the disease treatment and diagnosis. The physics approaches, for example, is X-ray, ultrasound, magnetic resonance imaging, and also like nuclear medicine. And for the treatment, probably the most well known is radiation therapy. That's all physics approaches. In this lab, the medical imaging technology we work with is X-ray. X-ray itself is nothing really special. It's just very high energy light. So compared to the visible light, X-ray has energy like tens of thousands times higher energy than the light we see in the sun. So just as if you want to see through this bouncy ball, and what you want to do is you maybe just push through the light and you can see what's inside the transparent bouncy ball. But for the human, you need X-ray. So if X-ray is so strong and so energetic, it actually shines through the patient. And so you can see the inside the patient with X-ray. It's give you a shadow image, similar just what we see on the screen is a shadow image of the patient. Medical imaging is a big help in the healthcare. For example, when the X-ray just came out in 1895, the first image they took is actually a hand-spun image. So people was amazed by the capability of X-ray at that time. It's the first time they can see through the patient without opening up. So, for example, if people have broken bones, before they don't know how serious the broken is, either how many pieces or where exactly the broken is, and then they cannot tell until they open up the patient. But with X-ray, you can just take an image and then you know exactly what's going on inside the patient. Medical imaging is a major tool to help the doctor to decide what kind of treatment the patient should go through. For example, if a patient has a tumor, they might see that in the CT scan there's a mass somewhere in the body, but they don't know exactly is it a benign tumor or cancerous tumor. So what they would do is either do MRI, further imaging, or nuclear medicine, another kind of imaging to further tell them what kind of tumor they are, and then treat it accordingly. The technology we use in this lab is X-ray, and X-ray is well known, is harmful for the humans because it's a radiation that could cause cancer, but it all depends on how much dose you'll be given. So, for example, the popular X-ray done in hospital chest X-ray, it's only give you 0.5% of radiation dose compared to the radiation dose you receive annually from environment. So that's a very small dose, very ignorable. As we know, X-ray has radiation risk to the patient, so it's on the hand of the doctor to decide how much risk he should take to benefit the patient. For example, if patient potentially can have a cancer in his lung, he probably will order the CT scan, although it's about 2 times of radiation dose as compared to the annual dose from the environment, but he should take it because the benefit to catch a cancer outweighs the risk of radiation. So the research going on in this lab is image-guided surgery and intervention. For example, on the back screen, this is a screenshot of spine surgery where the surgeon puts screw into spine bones, and you need the image to tell you where the screw is because you don't want to drill into the spinal cord, which will be a disaster for the patient. And to further on top of this, we want to improve this technology with real-time tracking developed in this lab. Real-time tracking is to track surgical tools inside patient in real time without using X-ray. To track surgical tools in real time, we attach tiny radioactive marker to the tools, and once the tools inside patient, this detector can detect the radiation from the tools and calculate location of the tools inside patient. Real-time tracking provides precise 3D location of surgical tools. We can reduce X-ray exposure from 15 frames per second down to 102 X-ray shots per second, which reduce significantly the dose to the patient. Same also to the surgery. I got my training in undergraduate and graduate in University of Science and Technology of China. So my major was in particle physics. After I PhD, I switched to medical physics, and I'm very happy that my training in particle physics turned out to be very useful in my current research.